Welcome back to another MedRevisions video. Today we'll discuss a November 2020 recall and also give you some tips for the PLAB Part 1 exam. Okay, let's dive right into the video. Before we discuss the question, take 50 seconds to read the question and answer it, then pause the video and comment the answer down below to see if you get it right. Okay, so we have a 5-year-old girl who visits her GP with her mother with complaints of nausea and dysuria, as well as increased frequency for the last few days. The girl appears well on examination and her observations are stable. The abdominal examination is unremarkable. A clean cat sample is obtained and it's positive for leukocytes and nitrates. She has responded well to antibiotics. What is the next most appropriate course of action? The correct answer here is no further investigations are necessary. Now, before we discuss the other options in this question, don't forget to smash that like button because that would help us help you. And also, comment down below on what other topics you'd like us to cover. Make sure you check out the reviews from our past PLAB candidates. The link is in the description below. Alright, so let's discuss the other options in this question. Okay, so why not an urgent ultrasound scan? So if a child is older than 3 years and the child has an atypical UTI, then an ultrasound scan during acute infection is what we need. So, there are certain features that are present in an atypical UTI according to the NICE guidelines. So these are the features. So septicemia, being seriously ill, having poor urine flow, presence of an abdominal or bladder mass, lack of response within 48 hours to treatment with suitable antibiotics, an unusual causative organism, not E. coli, and increased serum creatinine level. So because this child is over 3 years and she did respond to antibiotics within 48 hours, urgent ultrasound scan is not the correct answer. Okay, so what about ultrasound scan within 6 weeks? So, ultrasound scan within 6 weeks would be appropriate if the child has a recurrent UTI and if he or she is 3 years and above. DMSA. So DMSA is done normally 4 to 6 months after the infection, after the acute infection, and if the child is older than 3. So MCUG is not needed under any circumstance for a child above 3 years with the UTI. Okay? Now, please remember that the type of investigation to do next also differs completely if the child is under 6 months old and if they are between 6 months to 3 years. Okay? We just discussed the criteria and the investigations for kids over 3 years. So we have a wide variety of questions regarding UTI and other topics in our MedRevisions platform. So do make sure to check them all out and get familiar with all types of questions, and that will help you to tackle any type of question that you come across in the exam. So the correct answer once again is no further investigations are needed because this child is above 3 years old and this is a straightforward UTI, meaning that the child responded well to antibiotic treatments. Thanks for watching. This video was brought to you by MedRevisions, your go-to resource for PLAB Part 1. Complete your revision with MedRevisions.